Hello and welcome to Here's to Your Health. I'm your host, Veggie Patty, and it's my pleasure to bring you information on healthy living. On today's episode, we have a very special guest. This is Dr. Joel Kahn. He is a preventative cardiologist, so welcome to the show.
Well, thank you so much.
Yeah, well, I'm really excited to have you here on the show. I think there's a lot of people that definitely could benefit from the information that you have to share. So why don't you start by telling us a little about you? Like, how did you get started in cardiology? And we'll talk later about how you got more into preventative side, but what's your background?
Sure. I grew up in Detroit suburbs and was a pretty good high school student, got into University of Michigan pretty easy, went right to medical school, and at age 23 graduated, and I'm proud to say #1 in my class. It was pretty hard to do.
Congratulations.
And I knew I wanted to do cardiology. I mean, that was the thing. So I worked very hard and moved to Dallas, moved to Kansas City. And by 1990, 25 years ago, it's about my anniversary, I had trained as a cardiologist, as a cath lab cardiologist. I could beat up heart attacks. I could put balloons in. I knew how to do all the good stuff. And I came back to Michigan, first in Ann Arbor, and then since then, in the suburban Detroit area, I've been practicing cardiology nonstop. It's a fun job.
Great. So now what do you do I know you mentioned a few things, but what do you do as a cardiologist?
Cardiologist is usually involved in treating heart disease, so you already know you've had a heart attack, you've had congestive heart failure, you've got skip beat problems, and I see all those things all week long in the hospital and the office. But then became that question, are we able to prevent those problems I've spent the last 25 years treating?
Okay, that's great. So at the basic level, when you hear heart problems, a lot of people think of heart attacks and blocked arteries and things like that. What causes that? What happens?
Well, and you're right. There's actually all kinds of heart diseases, but the main one people today need to be worried about or concerned about or educated about is heart attacks. So basically, we're born usually with 3 beautiful arteries. They're just fuel lines to the heart. That's all they got to do is let the red blood go down to the heart muscle so the heart muscle can beat 100,000 times a day. When you're sleeping, it beats slow. When you're exercising, it beats fast and such. You just got to keep those pipes clean, and you're going to probably live to a long, healthy life and be very active. But unfortunately, those pipes are very prone to getting damaged, those arteries, and one or all 3 can get progressively narrowed, blocked, pinched down. I see a lot of arteries that look like a sausage link. Healthy artery, all of a sudden down to 90% blocked in a healthy artery. That's called hardening the arteries. That's called atherosclerosis. We know what causes it most of the time, and we know it's preventable, which is why tonight's conversation is so critical for everybody to listen to.
Okay, so what does cause it?
Well, the classic risk factors still remain, okay? You can't get around the fact if you're a smoker, you're doubling or tripling your risk of developing these sausage-linked terrible blockages. If you develop diabetes, which is a lifestyle problem unless you're a child, the child that develops diabetes, that's a different issue. Adults with diabetes, it's usually weight, inactivity, food choices. That's a risk factor. High blood pressure, so don't get high blood pressure. Stay thin, exercise, manage stress, eat healthy. If you have a brother, sister, mother, father that had a heart attack or heart disease young, 35 or 40, not grandma at age 90, maybe there's something genetic going on. That's much smaller than we ever thought. And your cholesterol, I didn't mention. So about 1 in 400 people are born with a genetic problem and their cholesterol is crazy. But 399, it's the fast food, it's the sitting in your chair, it's the bad sleep at night, it's the chips, the pretzels, the donuts, the cookies, the cakes, high cholesterol. So those are the big 5. There's other factors, but if you just worry about those, you're going to be well on your way to never having a heart attack.
Okay. So can you, just for our viewers, can you repeat those 5 factors again?
Sure. They are having a family history of, the most important are your brother, sister, mother, father at an age, before age like 55, heart attack, bypass, stent, so grandma doesn't count at an old age. Smoking, bad smoking. Stop right now, today. High blood pressure that requires treatment, and that's usually reversible. Diabetes, that's usually reversible. And the high cholesterol, and that can be reversible except this 1 in 400 genetic. Yeah. Heart disease is a food-borne illness largely. Genetics play a small role.
Okay. So now we've heard people talk before about heart prevention, but until recently a lot of a lot of doctors have said, no, you can't reverse heart disease if you had it, you just have to correct it with surgery. And that's one of the things that you talk to people about is actually how to reverse it as well, correct?
I have the great pleasure of dealing and actually demonstrating that heart disease can be reversed. I lecture all the time. I call it PDR. You can prevent it. The best strategy, never get heart disease. And I just mentioned 5 things, and we can talk about the science that says you can cut your risk of heart attack about 90% by things that don't cost any money, and you can start doing today. You just got to stick to them. No excuses, no whining, just do them. Detect, you can pick up heart disease years before a heart attack. That's what I really focus on. Don't have the heart attack. Let's pick it up early. But reverse. You have a blockage. You have a blockage in your leg, your carotid, your heart arteries. You can actually reverse it by changing your lifestyle. You may not want to, and my patients tell me I don't want to eat broccoli, I don't want to eat salads, I don't want to give up cheese. I said, fine, how does it feel to have your chest cut open? How does it feel to take chemotherapy? I don't take any grief from them. I mean, stop whining, eat your damn vegetables, let's get going. You don't need to have that blockage. And scientifically proven you can reverse heart blockage. So it's exciting to see people just do so much better with simple changes in their lifestyle.
Great. Well, since you had mentioned the surgery, and a lot of people maybe they don't know what it all involves. What does actually a surgery involve?
Yeah. Well, a surgery involves 2 options. I'm trained to go through an artery in the groin or the wrist up to the heart inside the arteries. It's a small puncture, and I can relieve a blockage by putting in a miraculous device called a stent. And if you're having a heart attack or you're in the emergency room having trouble, it can either save your life or make you much better quickly. No question, we make great advances and we still need to use them. But all those other people that are getting them kind of less emergency could have been avoided and treated in a way that reverses it. Bypass is a big operation still. It's amazing how well people do, but your chest gets cracked open with a saw, you're on a breathing machine, you get tubes stuck in you, you're in the hospital 3-4 days, you've got 6 to 8 weeks of getting back to normal, and it's not a cure. Stents aren't a cure. They're great like welding. They take care of the spot that's super diseased. They leave everything else to get worse unless you wake up and listen to well-done science that says, get your lifestyle in order. That's what you really need to do. And it's not expensive and it's simple.
So even if you have the surgery, you still have to change your lifestyle.
Well, the example, great question, is Bill Clinton. Obviously known early in his presidency as a horrible lifestyle, kind of doing better. How did that man not know he had heart disease with the best medical checkups in the world? That's a whole nother topic. But in 2004, he discovered with chest pain he was all blocked up, had his bypass, made some improvements, but he didn't really follow the plan the way he should have. I don't know how much he was told about all that. And a couple of years later, he needed a stent after bypass. How long did his bypass last?
Right.
That's about 3 or 4 years. So he's been doing so much better since he kind of needed that second kind of smack that said, hey, buddy, the bypass wasn't a cure. The cure is your fork. The cure is your feet and walking. The cure is never smoke with your fingers. That's what I like to talk about. And having friends that do the same thing. If you hang out with smokers that eat cheeseburgers and french fries, you're not going to do well after bypass. So one of the things we're doing in town, all over town, is we have this great support group going on that is supporting people who are trying to make the right changes, and maybe their boss or their spouse or their brother-in-law is giving them grief. So we've built in a really large support group for them.
That's great. And that's, like I said, is you have to really, if they want to get better, they still have to change their lifestyle anyways. So why not do it before the surgery if they're able to? And it's great that you have that support group. We have a local support group here that we've had many, many people that come to us after they've had the bypass surgery and they come and change their lifestyle. So let's talk about more on what do you recommend to people to reverse and prevent heart disease?
Sure. So what I recommend, to answer your second question, prevent, is based in science. It's now known, studies in the last 12 months, studies in the last 5 years, if you do about 6 things that are inexpensive and simple, you can cut your chance of ever having a heart attack about 90%. 90% is a big number. This is a disease that costs us hundreds of billions of dollars in work days, and husbands and wives are without their spouses and kids without their parents. It's a big problem. So it's going to sound a lot like what we talked about already. If you want to do 6 things, you won't have a heart attack. Don't smoke. Walk 30 to 40 minutes a day. Now, again, there's a few people can't walk, but a whole lot of people can walk. Park your car further, take the stairs, take a phone call standing, walk around your office. If you're at a conference, get around the back of the room, pace a little bit. So walk. Don't smoke, walk. Keep your waist thin, actually. You don't have to be perfect, you don't have to be twiggy, but you don't want to develop a really big abdomen. Number 4 you're going to love, eat more than 5 servings of fruits and vegetables a day. We're talking real, not canned fruits and vegetables. We're talking cooked or raw fruits and vegetables a day. And people say, 5, sometimes you should eat more than that, but 5 is a good goal. I can't do that. Well, if you're having a sandwich, you should have lettuce and tomato on it. No excuses. I mean, if you're having something at breakfast, there should be a tomato and spinach with it. If you're having dinner, half your plate ought to be fruits and vegetables, particularly fresh would be great. So that's number 3. Number 4 is controversial, but I'm going to tell you the science, is you should have an alcoholic beverage now and then during the month, unless you have a real problem with it or liver disease. That's science-based. That will lower your risk of ever having a heart attack. You should definitely try and get about 7 hours of sleep a night, very importantly. And you should, again, the final one that's been shown in studies, associate with other people. Have friends that are health-minded. Sometimes it turns out that's one of the most important steps. So you can drop your heart attack risk by about 90% with, how much did that cost? You're not buying cigarettes, it's cheap. You're buying fruits and vegetables, great deal. You're walking, that's free. You're sleeping, that's free. You got friends that are healthy, that's free, or support groups or your group. So, we don't need to have heart attacks in this community if people would just do those simple steps. And, then they don't need medicine, then they don't need to have their chest cracked. And, I hope to have an empty waiting room. I really want to have nobody waiting to see me. I mean, I'll be happy when that day happens, but everybody out there needs to listen.
Right. Now, just to clarify, because I know we'll get questions on this, when you say everybody needs, that people can get a little bit of alcohol, is there a specific type? Because you hear about red wine, or is it any type of alcohol? Because I don't think it's necessarily the new flavored ones that have come out. So what have they studied on? So
the type of alcohol in scientific studies, frankly, doesn't seem to matter much. And I agree with you. If there's tons of sugar in a sugary wine cooler, okay, we're going to take that off the map. Red wine particularly has the most active agents that we think help arteries in the heart. Frankly, there's data that beer has a few active agents if you're not gluten sensitive, because most beer is wheat-based, of course, grain-based, and even hard liquors. But the data, if you want to know, is 1 ounce of hard liquor, 5 ounces of wine, which is a small pour, 8 ounces of beer, 1 glass a day on a regular basis will generally lower a person's risk of ever developing a heart attack. Now, again, very cautious statement, because abuse and traffic, accidents and people with liver disease. But if you're responsible and can be controlled on it, again, let's go back to not smoking and walking and eating those 5 servings of fruits and vegetables and sleeping. But it's all part of the overall plan to be heart attack free your whole life.
Okay. Now, I want to ask you about specific foods. So I always tell people that, the American flavor palette is salt, sugar, and oil.
Yep.
So how do those 3 things play into a diet to help prevent heart attacks?
Right, and salt, sugar, and oil are the basis of, since about the 1950s, when fast food restaurants showed up and gas station and vending machines, what's often called processed food. Some people make a funny word, Frankenfood, like Frankenstein, because it's just scary. But the food industry, which I often feel, unfortunately, is a lot like the cigarette industry, has really figured out what our hot buttons are. And when you make the right mix, whether it's called a donut, whether it's called chips, whether it's called certain kinds of breads and cakes and cookies, salt, sugar, and oils or fats, you will render us almost unable to say no and resist, because it's just lighting up our brain and making us say, we want more of this. Unfortunately, salt causes high blood pressure and probably stiffens arteries to cause those blockages. Sugar is actually related to a higher heart attack risk, and you should get your sugar content low, except for fruit. Fruit's okay, whole fruit, not canned fruit, whole fruit. And then oils and fats for sure. I mean, there's no doubt, despite a lot of confusion in the public, that cutting back on your oils are processed. An olive is a plant. Olive oil is a factory-derived processed food. Even olive oil, the holy olive oil, should be reduced if you want to leave your arteries clean. and certainly if you want to reverse heart disease. So, we've lost the art of cooking. We lost the art of going to farmers markets or having a garden in our backyard. Thank goodness it looks like some of that is coming back. But be very careful at restaurants. I tell my patients, be extreme, and that may not sit well with everybody, in your food choices. You can be moderate in your exercise, but what you do with your fork, I tell everybody, your fork is like a surgical instrument. Your fork will determine bypass or stent, or maybe live into 90 in good health and vitality. Every time you take a bite, it affects your genes, it affects your future. And yeah, none of us are perfect, but you got to be pretty good most of the time. Moderation is the key, is absolutely not true. Moderation kills people. The American Heart Association diet is a moderate diet. I don't accept that. We need to move. If you're trying to reverse heart disease, if you're serious about having good health, low medical expenses, keeping your costs down, eat healthy every day. Best step you can ever do.
Great. So let's talk about some of the support groups and the materials that you provide, because you do provide a lot of free material to people. You have a blog, you have a newsletter, you have an active Facebook page. So what are some of the things that you're doing to try to educate people?
Yeah, I am a chatty person all the time, whether it's on a wonderful event like this that you invited me to, and thank you. But the free things I do, I have a website. I think you're going to put it up on the screen. There's a newsletter anybody can sign up for, put in your email once a week. It's got some really good health information, and there's nothing to sell, at drjoelkahn.com. I'm also on Facebook at drjoelkahn.com, and I actually write all over the internet, but I end up putting everything on my Facebook page or my personal website. So you can go to my website now, and I'm very happy to say dozens of Fox TV and other TV station interviews on health, hundreds of things I've written that will give people a good guidance. And I got to say, I'm really pleased to say this. I mean, even as recent as just this week, people who I've never met, who simply have been reading and listening to what I put out, have lost weight, have dropped medicines, have felt more energetic, have friends coming up to them and saying, what's going on? And it's kind of the Kahn factor going on, because I'm relentless. I mean, we live in a tough world of bad food, bad air, bad water, bad sleep, and bad stress. And you have to take the responsibility, or you're going to suffer the consequences. But the solutions are simple.
Right. Now, you have a book as well, correct?
I do. I have one and several coming, but I have a book called The Whole Heart Solution. Came out about 2.5 months ago. It's at Barnes & Noble's, it's at Sam's Club, or if you're on the internet, it's on Amazon and such. And it's about 300 pages of how to never have a heart attack by healthy living. Turns out it's the same formula to prevent cancer, same formula to prevent dementia. It's, it's a healthy living book that is generally pretty easy to follow.
Okay, great. And I'm going to work on trying to get Dr. Kahn somewhere downriver to do a talk and have your book.
I'm here.
So tell us more about the support group that you have.
Yeah, so real quickly, in my 25 years of practicing cardiology, I have had a lot of patients that have studied. They got to study, they got to watch a video, they got to read a book about how to reverse heart disease. I guide them. But we never got together and hung together. I mean, it just didn't happen. And about a year ago, somebody called me and said, I'm doing that program. I am eating healthy. I feel wonderful. Who else is? I'm lonely. Who else is on Thanksgiving passing up on the turkey and eating the broccoli, the Brussels sprouts, and the sweet potatoes? We formed a support group. I expected a couple dozen people. We now have 600 in a support group. We meet once a month. There's no charge. Now we can bring in some guest speakers, and in January, a very famous Dr. Caldwell Esselstyn will be coming in. We expect 1,000 people at his lecture. He changes people's lives. If you're tired of pills, and if you're tired of bypasses, and you're tired of stents, you've got to come listen to Dr. Caldwell Esselstyn, and it's no charge. So we're having so much fun with it, and what I'm seeing is much faster pace. People are getting it. They feel comfortable telling their relatives or friends, this is what I'm doing, and I'm not alone. I got all these peers that are doing it, and they're seeing results. They're losing weight, they're dropping meds, they're feeling energetic, and over the long haul, they got a good shot of living longer if they just stick with it. So, having friends to do a hard job is going to make it easier.
Great. Now, how does it work with, obviously, if people are coming to you as a cardiologist, then they're probably being referred by a doctor. So how do other doctors receive this information that you're putting out there?
They look at me, I've been doing this for 25 years, and I've kind of been outside the crowd for 25 years. I'm okay with that because, when you got science behind you and results behind you, I'm not going to go back to old-fashioned and, frankly, wrong medicine. I mean, hospital food, when will hospitals get the idea that food can heal, food is medicine, and let's start feeding both our guests and the patients healthy food. So I'm always on the warpath about let's take science and apply it to patients. Docs are getting it because, frankly, the media is getting it. We got some athletes and we got President Clinton and this and that. People are hearing of health benefits. We've got ultra athletes that are running 100 miles eating plants only, lentils and beans and grains and sweet potatoes and the rest. But they're not doing it. I mean, unfortunately, we do not get good nutrition education in med school, and we don't get it after med school, God knows. So they're just lost. And I mean, anybody listening today who's a physician, I mean, please grab on. You're going to have so much more fun treating patients when you understand how both medication, which I use, surgery, stents in my field, which I use, but if you get lifestyle education down, your patients are just going to blossom and bloom and feel so much better. And it makes medicine much more fun.
Great. So can you tell us, what's a day in the life like for you as far as your lifestyle?
Well, today, for example, and I only do this now 2 days a week. I got up at 4:30. I'm at the gym at 5 a.m., and I put in a hard hour of exercise. I told you my belief is diet, be extreme, moderate, and exercise. In my younger days, I got up 5 days a week at 4:30 to work out. I don't do that. 2 days a week, and the other days I might just work out for 15, 20 minutes and get my sleep. Sleep is so crucial. I am vegan, plant-based for almost 30 years, so there's no bacon, there's no eggs or cheese in my diet. I'm going to have a big bowl of oatmeal. My health club makes this amazing almond milk, kale, avocado smoothie in the morning, or I make it at home just like that, put some flaxseed. I'm going to work. I got energy. I got vitality. I'm going to work all day long. I mean, this is at the end of a long day. Great. Let's keep going. I'm going to, keep going and really have unstoppable energy, and I really credit my diet for most of that. But I do a lot of self-care. I make sure I get sleep in. I make sure I get a little, quiet time, whether you call that meditation, yoga, obviously family time with wife and 3 kids and 2 dogs that I love very much, and a daughter-in-law. So I look for balance, but when you have passion and energy, it's a little more work than relaxation, but that's great. I mean, this message is important, and that's why I thank you for having me on.
Yeah.
So, also I'm a student for life. There's not a day goes by, I don't think I learn 5 new things because I'm listening or reading or watching. Maybe short, maybe long, but usually by about 6 a.m. I've read 15 medical articles briefly just to know what's new today, and that's what I put on my Facebook page or Twitter account because it's cool stuff.
Okay. So can you tell us now, you brought up sleep a couple of times, and I think a lot of people, we all know that we're all sleep deprived in this country. So Why is sleep so important?
Yeah, the average amount of time people sleep has dropped by about an hour and a half in the last 50 years, and we're paying a price for it. Sleep is rebuilding time. Sleep is, a restaurant is busy all day long. At the end of the day, they got to lock the doors, they got to clean the floors, clean the kitchen, put the stools on top, and get it all ready for the next day. That's what sleep is. And if you shortcut it, you don't get the chance. So your body during sleep is readjusting hormone levels. It's building back up vitamins and antioxidant levels that you burn through. We damage our DNA during the day from stress, from sunlight, from chemicals. You can repair those. You need about, every sleep cycle is 90 minutes. You need about 5 of those. That's going to be about 7.5 hours of sleep, uninterrupted, to get the best sleep. Now we get up at night. The problem is now we've got iPads, we've got phones and digital TVs, and we're wired in, and we're really disconnecting from that opportunity to get back to good sleep. It really messes up our hormones. So we need our growth hormone to go up during sleep, but you got to stay in bed and fall asleep. Women are more disturbed in sleep than men. And then the other problem is, just besides just shortcutting it and all the electronics and all the rest, is we're getting heavier and people snore and people stop breathing. That's called sleep apnea. It's a real condition. Not everybody is overweight that has sleep apnea. There's lots of thin people with big tonsils or other oral airway issues. But if you have sleep apnea, you're snoring, you stop breathing, your oxygen levels go down, you're going to suffer some health consequences. And if you don't go for a test, and if you don't go for treatment, which might be a mask, a bite plate in your mouth, losing weight, you're going to suffer, and your risk of diabetes, heart disease, and even premature death go way up. So if you have a spouse, a friend, a relative that's snoring, that's stopping breathing, just give them a jab and take them over to a sleep lab and let them get checked out, because they'll feel better if they have the problem and get it treated. And then look for the root cause, because they might start to lose weight as soon as that problem is taken care of.
Great. Well, I want to thank you so much for being on the show. We're just about out of time. So is there any final message that you want to get across to everybody?
I mean, this is not a radical discussion that we've had today. The best care is self-care. I mean, and the best care is food is medicine. Hippocrates said it 2,500 years ago. There's other things on the list, like movement, like standing, like exercise, like not smoking, like getting adequate sleep. But look right now in your refrigerator, look in your pantry, look in your grocery cart, look on your shopping list. If, you know, about half of that isn't in the produce section, brightly colored, rainbow-colored red peppers and pomegranates and, you know, kale and chard and white potatoes and red potatoes and blueberries. You know, rethink that, because that's what you need to be spending your money on, and you're going to see your health blossom, and it's really simple.
Great. Well, remember that no matter the cards you were dealt or your current state of health, you have the power to take charge of your health. So never give up and never stop learning. The solution you seek may be just around the corner. So I want to thank you again for being on the show, and if you can join me in a toast to the viewers, and I'm sure you're very familiar with cucumber juice. So
thank you. Cheers to your health.
We wish you a wonderful today and an even better tomorrow. Here's to your health.